Hello, my name is Erin Beecher, and I will be doing my presentation on electronic health records, or EHRs. What are EHRs? EHRs are electronic health records. They're computer-based patient medical records. They basically store all of the patient's histories, diagnosis, test results, and encounter comments. Information from electronic health records can also be shared amongst different healthcare networks. Um, as far as healthcare legislation and EHRs, there's been federal support of the implementation of EHRs. Basically, it's been said that eligible professionals in hospitals that adopt, implement, or upgrade to certified EHRs receive incentive payments. Um, it was also quoted in Health IT that as of 2016, over 95% of hospitals eligible for the Medicare and Medicaid EHR incentive program have achieved meaningful use of certified health IT. So some EHR capabilities and benefits. It's integrated patient health records. So you'll no longer need to have paper records that can easily be destroyed or lost. Healthcare information is also easily backed up with your IT program. Another benefit is that it's easily accessed. You have easy access to patient history and patient results. So basically, you're able to share the patient information amongst different healthcare organizations. And it was also quoted that using the EHR as an interprofessional communication tool may simplify access to current patient data for all healthcare team members, leading to improved continuity and higher quality of care. Another benefit or capability of EHRs is that it increases healthcare organizations' efficiency. It's also quoted that healthcare information technology, or HIT, such as EHRs, has the potential to address the primary care workforce shortage by improving the efficiency of primary care practices and the productivity of primary care physicians. Basically, EHRs, they just increase overall efficiency within hospitals because you actually have the access to the patient information, and it's so easy to access it that you don't have to have that downtime of making a phone call to someone else to double check patient information because it's right there on that electronic record for you. Another capability or benefit of EHRs is that they allow for CPOE, which is just basically physician electronically inputting orders such as lab tests, prescriptions, and instructions. So it's computer-based physician ordering. This reduces on any transcription or interpretation errors that could be caused by trying to take an order over the phone. And it also increases efficiency because pharmacists and lab techs, they're able to receive orders basically in real time as they come in. Another benefit or capability of EHRs is that patients can now view their own test results and manage their own healthcare experience. It's been quoted that online patient portals afford access to a variety of features, including viewing recent lab test results and visit summaries, refilling medications, and making appointments, and sending secure messages to all healthcare provider teams. And it's also been quoted in Health IT that 1 in 3 individuals tracked healthcare charges and costs with a computer, smartphone, or other electronic means in the past 12 months. So, all right. So another important aspect of EHRs is MACRA, which is the Medicaid Access and Chip Reauthorization Act. This was basically passed in 2015, and it's been quoted in NRHI that under MACRA, participating providers will be paid based on the quality and effectiveness of the care that they provide. So MACRA basically set into legislation that we are going to switch over to a pay for performance model. We used to use a fee for service model, but now we're going to actually go over the whole patient experience, and that's how you receive reimbursement. And Under the pay for performance, there are different payment models that are followed, and there's the merit-based incentive payment, alternative payment models, and advanced alternative payment models. Another important thing about MACRA is that healthcare organizations receive payment per each patient's encounter visit. So now that we're actually going to a pay for performance model, basically what we're saying is that every patient, when they come to visit, it's considered a whole encounter. So everything that has to do with that one patient visit. So that can include doctor's visits as well as specialty visits to a specialist. That's all included under one encounter because it all has to deal with one patient visit. And basically, EHRs play within the MACRA legislation because electronic health records help to organize patient encounter information by bundling each visit together with diagnosis information, test results, encounter date and time, and billing fees. So basically, anyone who participates in MACRA would really want to look into getting the EHR system because it helps to organize all that patient encounter information. That way, it's less likely for the organization to not receive reimbursement for an encounter. So as far as EHR systems, there is definitely been a big change in what past EHR systems used to look like and what they look like now. Basically, the prehistoric or the very first EHR systems that came out, they looked sort of like this right over here. The older EHR systems, they had very limited capabilities, simple functionality, limited character entry, and limited information storage. So it's basically like the very basic old school first ever computer programs. Now the newer EHR systems that are used, they have far more functionality. They are more user friendly. They increase the ability to add more documentation, and they also have the ability to be upgraded. So whenever there's a software upgrade, people are able to upgrade their EHR system so they can stay with the times and always have the latest and greatest when it comes to their EHR system. So although EHR systems are very great and they do great things for the healthcare organization, there's still some things that are adaptation barriers or some things that could get in the way of possibly implementing a new EHR system in a healthcare organization. The first thing you want to think about is IT security and HIPAA. You want to make sure that patients' information is kept secure and shared amongst different organizations within HIPAA standards. It's been quoted that new processes for EHR implementation and evaluation will be required as healthcare shifts to a patient-centered model that includes patient families, multiple agencies, and interpersonal teams in short and long-term clinical decision-making. Also, with EHRs, you want to think about the cost that it takes to implement a new system. Some smaller organizations may not see the benefit with compared to how much it costs to implement it to how much they make. Another important barrier that could get in the way is new operator training. You want to make sure that employees can get trained properly before they use the system. Other barriers as well are IT shutdowns, because every network does have their glitches sometimes, so you need to take into account that there could be shutdowns in your system. And then another barrier that could get in the way of implementing is that the fact that patients may now have too much access to too much information and become overwhelmed with what they are seeing. So a few recommendations, because EHRs bring far more benefit than they do drawbacks. A few things to help make sure that the EHR system is successful during implementation. You want to make sure that you can give extensive training to your new users. You want to offer in-depth onboard training as well as continued education whenever upgrades occur. You also want to make sure you create a plan or protocol as far as IT shutdowns and security issues. You want to make sure that you have an organized downtime protocol. And lastly, you want to make sure you review patient EHR information to ensure understanding. Offer patient customer service that deals with their access to their EHRs. And then you also want to allow physicians and nurses to be able to review patient information during appointments. And then in conclusion, EHRs offer far more benefits than they do drawbacks. A few of the benefits of EHR are increased efficiency, CPO capability, and increased organization. Um, there have been incentives given to organizations that implement EHRs for switching over to the pay for performance, and as far as the MACRA legislation that has been made, so there is government backing for EHRs. And then also EHRs, they just continue to update and enhance as the years go by. So they're going to continue to only get better and improve the healthcare that we are able to give our patients. And then that is the end. Thank you for watching my presentation.